Welcome back to another episode of Drug Talk, everybody. In today's video, I want to quickly go over 3 things you should be aware of before using clindamycin. Number 1, there is a black box warning associated with clindamycin. This warning is really associated with all antibacterial agents, so patients who use clindamycin should be aware of it. Clostridium difficile associated diarrhea has been reported with pretty well all antibacterial agents, including clindamycin. This could range in severity from mild diarrhea to life-threatening colitis. It has been observed to begin up to over 2 months after taking an antibacterial agent. Physicians should always consider Clostridium difficile associated diarrhea as a diagnosis when patients present to the clinic with diarrhea after using an antibacterial agent such as clindamycin. If Clostridium difficile is confirmed, all antibiotic therapy that is not directed towards Clostridium difficile may need to be discontinued. Because clindamycin has been associated with severe colitis, which could be fatal for some patients, this medication should be reserved for more serious infections that less toxic antimicrobial agents would be appropriate for. Number 2, serious skin reactions can occur with this medication. Check with your doctor right away if you have any of the following: blistering, peeling, loose skin, red skin lesions or severe acne, skin rashes, sores or ulcers on the skin, or fever or chills while you're using this medication. With many antibacterial agents, a rash can occur as a symptom of an allergic reaction. However, if you do develop a rash with clindamycin, you should take it more seriously because of the increased likelihood that it could be a more serious issue causing it. If you were to develop a non-serious rash, it would typically happen 7 to 14 days after starting the medication and then would resolve 7 to 14 days after stopping clindamycin. So again, just remember to always contact your prescriber if, while taking clindamycin, you develop a rash or different skin reactions. And number 3, patients who use clindamycin may sometimes experience issues with their liver. There are 2 common side effects that will indicate liver issues for patients using clindamycin. One of them is seen on blood work, where the patient would see an elevation in their liver enzymes on a liver function test. The results will have elevated AST and ALT liver enzymes. Another side effect to watch out for is known as jaundice. Jaundice is a condition where excess amounts of bilirubin circulating in the bloodstream end up dissolving into subcutaneous fat. This could cause a yellowish appearance in skin or the whites of the eyes. If you are to notice these side effects, be sure to contact your healthcare team. And that's all we're going to talk about today with clindamycin, but before you take off, I wanted to quickly let you know that you can pick up a copy of my new book, The 5th Episode, Inside the Manic Mind, by clicking on the link in the description of this video. Take care.